Hello, my name is Delaney Whitlow, and this is my presentation on the country of Norway. Norway's healthcare system is regulated by the National Insurance Act and the Patients' Rights Act. The national government of Norway is in charge of providing healthcare to its citizens, regardless of their social status, economic status, or geographical location. The government is not only responsible for overseeing the provision of care, but they are also responsible for funding and regulating care. This responsibility is shared with municipals and through municipal councils. The responsibility of providing long-term care also falls under municipals, as it is not included in the universal health care coverage. The organization of primary care, preventative care, and nursing care is organized locally, and the government is responsible for specialty care and hospital care. This is organized locally through the regional health authorities, or RHAs, and the RHAs have the overall responsibility for implementing national health policy through planning, organization, managing, and coordinating activities with the hospital and pharmacy trusts in their region. The government of Norway oversees a majority of the funding for their universal healthcare system through the general tax system and household out-of-pocket payments. The rate of taxation for healthcare is set in the national budget. Private and public funding accounts for the majority of healthcare costs. Public funding, which is from national municipal taxes, accounts for 76% of funding, and state and payroll taxes account for 11% of funding. Once residents reach the age of 16 years old, they are required to pay a yearly deductible of $2,000 and okay. Local budgets are set by municipality councils. The funding for these consists of block grants, accounting for 45% of funding, and taxes, which accounts for 55% of funding. Norway is considered a constitutional hierarchy monarchy. The government is composed of the Prime Minister and the Council of State, which is chosen by the monarch and the approval of the Storting, which is the country's legislator. The country's legislators are appointed through an election that is held every 4 years. There are a total of 169 members of the legislature, and citizens of 18 years and older are allowed to vote in the elections. Norway's population is 5,456,505. Life expectancy for women is 84 years of age, and for men it is 81 years of age. People in Norway are most commonly living in an urban environment, with 83% of the population living in an urban area. As healthcare coverage is universal in Norway, everyone has access to receiving it. Coverage is automatically started at birth and continues for free till citizens reach the age of 16. After reaching 16 years of age, citizens are required to pay an annual fee for the service to be provided. Women who are pregnant or breastfeeding also receive free healthcare coverage. Access to care is easily accessible, and patients are able to choose their own general provider. For those that wish, they can opt out of the public healthcare system and purchase private insurance. However, this is very rarely done. The healthcare system delivers high-quality care to patients, but waiting times have been known to be long for certain procedures. Norway and the United States have very different healthcare systems. As healthcare is universal in Norway, everyone is offered health insurance and coverage. This means that no citizen goes without healthcare coverage. This is very beneficial to the population and ensures that everyone receives the same quality of care, as the government owns and controls a majority of the hospitals in the country. Urban care versus rural care is an issue in Norway, as there are health discrepancies within rural areas. A big issue in Norway are the long waiting lists for procedures and patients can also be denied care if it is not deemed cost effective. Healthcare in the United States is primarily private insurance through citizens' employers and government insurance called Medicare and Medicaid. The United States has no universal health care, and it is one of the most expensive healthcare systems in the world. There are major discrepancies in healthcare in the United States, and while the United States would benefit greatly from a universal healthcare system such as Norway's, there's a lot of political debate keeping the country from having universal healthcare. Norway's e-health directorate has the responsibility for leading the development and leading the application of health information technology, as well as being responsible for the national strategy for health information technology and providing information on the performance of health services. The National Health Network provides secure telecommunications for hospitals, general providers, pharmacists, nursing homes, dentists, and other healthcare providers. This allows for the secure exchange of information on the patient's record between all parties in the health and social services sector. All general providers use electronic health records, and they transmit prescriptions electronically to pharmacies as well. Residents of Norway are given a personal identification number that is unique to themselves and that is used for the transfer of primary care and hospital care records. The death rate in Norway in 2020 was 7.9, although this does not include the numbers from the COVID-19 pandemic. The infant mortality rate is 1.7 deaths for every 1,000 live births. Death for children under the age of 5 is 2 for every 1,000 live births. Almost 1 in 7, or 14%, of Norwegian adults are classified as obese. Almost 1 in 6 Norwegian teens are classified as obese, and it has increased by over 50% in the last decade. The leading cause of death in Norway in 2019 was cancer and cardiovascular disease. The Organization for Economic Co-ordination and Development, or the OECD, in 2016 healthcare expenditures were 10.5% of the GDP. This is equivalent to 68,000 NOK per person, or $6,647. In 2018, Norway's healthcare spending GDP was 10.05%. The GDP per capita is 43,009. Norway measures the effectiveness of their healthcare system through the National Board of Health Supervision. The National Board of Health Supervision audits all of the different areas of the health system. There is an alert system in place that notifies the board if a seriously adverse event takes place, and it is up to the board to investigate the incident further. The board also has the ability to issue fines and warnings to institutions and health personnel, and they can revoke a health professional's medical license. Hospitals are required to implement quality and safety training that requires them to measure and be responsible for the overall performance of the hospital. Evidence-based guidelines, patient pathways, and bundles are used for care on a national scale for certain conditions like stroke and cancer. The Directorate of Health is in charge of overseeing the national program that tracks healthcare quality indicators, which is conducted through patient surveys as well as quality indicators, as well as the licensing and authorization of healthcare professionals. Research and innovation in Norway has many different means of funding. Universities and hospitals provide funding, as well as private businesses. The government has tried to promote innovation in the country by providing funding to innovative projects, as well as promoting awareness of these programs to try and drive healthcare innovation. There is no claim on the responsibility for innovations and research, and the responsibility gets lost between the ministries and the co-organizations. Due to this, innovation typically occurs from the bottom up, focused on researchers' interests, rather than the top down, focusing on the needs of the community and its citizens. Norway handled the COVID-19 pandemic well compared to other countries because they shut down the country very quickly and contained the spread of the disease. Their universal healthcare system allowed for people to be tested for free, and this encouraged many people to be tested, allowing the public health department to track the spread of the disease very easily. Norway's response to COVID-19 pandemic was to limit the spread of the disease, mitigate the economic effects, and to engage with the social consequences. The Norwegian Institute of Public Health was in charge of all the data collection for COVID-19 pandemic, as well as publishing reports that updated the country on the COVID-19. In conclusion, Norway is able to offer their citizens universal health care that begins at birth and is free until they reach the age of 16. Their system of health care is great for the country as a whole, but there are visible disparities between those who live in rural areas versus urban areas of the country. Overall, the country of Norway offers its citizens a health care plan that covers everyone, provides the same quality of care to everyone, and is affordable to everyone.